Post-operative instructions, teeth extractions, and bone grafting. If you notice some grittiness in your mouth, do not be alarmed. Some of the bone graft particles will work their way out of the extraction site. We cover the graft with a dissolvable sponge. Do not be alarmed if this falls out during the healing period. Bleeding. After tooth extraction, it's important for a blood clot to form to stop the bleeding and begin the healing process. That is why we ask you to bite on a gauze pad for 30 to 45 minutes after the appointment. If the bleeding or oozing persists, place another gauze pad and bite firmly for another 30 minutes. You may have to do this several times. You may also moisten a regular black tea bag, apply it to the extraction site, and hold firm pressure. The tannic acid in the tea bag will help stop the bleeding. After the blood clot forms, it is important not to disturb or dislodge a clot as it aids healing. Do not rinse vigorously, suck on straws, smoke, drink alcohol, or brush teeth next to the extraction site for 72 hours. These activities will dislodge or dissolve the clot and retard the healing process. Pain and swelling. After the tooth is extracted, you may feel some pain and experience some swelling. An ice pack or an unopened bag of frozen peas or corn applied to the area will keep swelling to a minimum. Take pain medications as prescribed. The swelling usually subsides after 48 hours. Use the pain medication as directed. Call the office if the medication doesn't seem to be working. If antibiotics are prescribed, continue to take them for the indicated length of time, even if signs and symptoms of infection are gone. Oral hygiene. Mouth cleanliness is essential to good healing. Clean your mouth thoroughly after each meal, beginning the day after surgery. Brush your teeth as best as you can. Rinse with warm salt water, a half teaspoon of salt in an 8-ounce cup of warm water, 3 to 4 times a day. Continue this procedure for the first week after surgery. Activity. Limit vigorous exercise for the next 24 hours, as this will increase blood pressure and may cause more bleeding from the extraction site. Diet. Drink plenty of fluids. Avoid hot liquids or food on the day of surgery. Soft food and liquids should be consumed on the day of surgery. Return to a normal diet as soon as possible, unless otherwise directed, but try to avoid chewing on the surgical site. After a few days, you will feel fine and can resume your normal activities. If you have heavy bleeding, severe pain, continued swelling for 3 to 4 days, or a reaction to the medication, call our office immediately at 360-293-2808. Our after-hours emergency number is 360-647-4027.